3-year-old child is brought by his mother with multiple bruises and fractures. His growth is satisfactory. His stepfather was looking after him as mother was at work. What reason for his presentation will you suspect? You would be suspecting a non-accidental injury because a 3-year-old child should not have multiple bruises and fractures, and there is history that someone else was looking after him. At least that thought should cross your mind, and you need to discuss with seniors. Child suffering from asthma presents with a fever of 39 degrees and is needing oxygen by mask. He is being treated with nebulized salbutamol and oral prednisolone. What sign will indicate that he is deteriorating? If this child starts to become drowsy, he may be worsening. Asthma attack would persist for some time and treatment would be required for a few days. So intercostal recessions could persist. Child could become wheezy in between salbutamol doses and may need this often. Four-month-old boy has been brought to ED after a brief apneic episode at home, but he is now completely well and his parents are anxious as cousin died of sudden infant death syndrome at a similar age. Parents are asking guidance on BLS. What is the single most recommended technique for cardiac compression at this age? It is recommended that in infants you give chest compressions with index and middle fingertip of one hand. You are teaching BLS to parents of a 4-month-old baby. What is the recommended ratio of cardiac compression to ventilation for a single lay rescuer? This is slightly tricky, as in pediatric age group, the ratio of 15 compressions to 2 ventilation is recommended, but that is easier if there are 2 resuscitators. For a single person, they can use the adult ratio of 30 compressions to 2 ventilations. 3:1 is used in neonates. 3-year-old child is brought to the ED with a swelling over left arm. You also find bruising on child's back. X-rays show fracture of left humerus and also multiple callus formation on the ribs. What is the most appropriate next step? You have found a fresh injury and old injuries. You will next check whether the child is on the child protection register and then proceed to initiate child protection procedures. 3-year-old child is brought to ED with multiple bruises and swelling of left arm. You ask for X-ray of left arm and it shows fracture of the left humerus. During child protection assessment, what investigation can gather evidence of old or multiple injuries? A skeletal survey is done to look for multiple injuries. 6-year-old boy is clinically obese with BMI more than 95th centile. He has no other medical problems. His examination is normal, including blood pressure. Mother says that she has tried everything to help him lose weight. What is the most probable diagnosis? This is simple primary obesity. Cushing syndrome would have high blood pressure, and other syndromes would have dysmorphic features. 6-week-old formula-fed baby is brought for routine checkup and is found to be deeply jaundiced. His weight gain is poor and his stools are pale. What is the most likely diagnosis? This baby has obstructive or cholestatic jaundice because of biliary atresia, which is now persistent and worsening at 6 weeks age. he needs to be referred to a surgical center soon. 15-month-old child is due for his MMR vaccine. Mother is concerned that there is family history of egg allergy in uncle. The child has fever and is found to have acute otitis media. What is the single most appropriate action? The egg allergy in uncle or suspected egg allergy in the child is not a contraindication to give MMR vaccine. The child is currently unwell with a high fever and otitis media, so you would defer the vaccination for two weeks. 3-month-old baby was miserable and cried for 2 hours after his first routine immunization. What is the single most appropriate action for next dose? You would proceed because crying can be normal. As long as there are no evolving neurological features, you would not change the vaccination.